So, hi everybody. In these corona times, we are trying to be a little bit innovative, as also is the purpose of this whole course. And in order to not only do the Zoom in a traditional way, today I have gone all the way up to Stockholm to meet a very good friend and expert on gender-based budget. And by the way, Maja, who I'm going to introduce herself, has experience both from Western Balkans and from Eastern Europe, so she's the perfect person to talk to you about this topic. Maja, welcome.
Tack så mycket, thank you.
Yeah, she can also speak some
I
Swedish.
try to speak a bit of Swedish.
Let's do this in English, right?
Yeah.
Why don't you introduce yourself a little bit and then also explain to us how did you come into this area of gender-based budget?
Yes, so I am Bosnian, so I come from Sarajevo. And I started, I'm an economist, and I work in public finance management since the start of my career. I started working with gender-responsive budgeting in, some 15 years ago. And since I started working with gender budgeting, I never really stopped because I and many colleagues around the world think that this is really the way to do budget reforms and performance budgeting reforms and public finance management. So I was working in development projects first in Sarajevo, and I was working with gender-responsive budgeting, but then I worked also with UN Women, and then I moved to Ukraine where we met, which was in 2014. So I was a team leader for the biggest gender budgeting project in the world, and I like to mention that because it was really, it still is, ongoing project, and I hope to yield good results there. And now I'm here in Stockholm, and I work for the same company I worked with when I was in Kiev, which is NIRAS, and I work there also on gender budgeting and other issues that we work on.
So for those that doesn't know, and I think actually that is quite a large number of our students, how would you explain gender-based budget? Or you also call it sometimes gender-responsive budget?
Yes.
I think it's the same.
It's the same. It's the same because in the heart of the concept is really women and men in a different socioeconomic position. So what we are trying to do with gender-responsive budgeting, we are trying to bring gender equality discussion in the arena of public finance management. So when we were discussing about, I know that you were discussing with your colleagues budgets before and the importance of public finance. And we have come to realize that unless we bring gender equality discussion in the arena of public finance, very often this discussion remains somewhere completely outside. So we are doing gender-responsive budgeting on one hand for gender equality and closing gender gaps, which are many still in many countries, including Sweden. But we are also doing it...
Thank you for mentioning this.
But we are also doing it for the sake, and that's where my interest comes from, for the improving the way we work with public finance management. So I think I advocate for understanding the budget implications. So what we are, in very simple terms, what we are trying to do with gender budgeting, we are trying to look at the both revenue side of the budget, which is tax and fees and everything that we are putting into the budget. We are also trying to look how our tax policies influencing different groups of women and men. And what came to me as a big surprise, not a big surprise, but actually a big surprise, is that for so many years this discussion was completely outside of discussion on tax systems or expenditure systems. So for example, when we plan any investment project, being it building a new school, building a new bridge, any kind of investment, we didn't even look at what kind of implications it will have on citizens, women and men in different socioeconomic positions.
Let me just stop you there.
Please.
But with the impact-orientated budget or result-based budget, maybe that is more what we are trying to do, didn't anything come from that reform?
Yes, this is a very good point. Something did come from that reform, but not necessarily gender equality. What came out from that reform, and I am very passionate about result-based budgeting, result-based management, I was also surprised how for so long we did financial planning or planning of the projects without really measuring the impact. So now this is a very logical thing to do. However, we would stop at measuring the impact as we defined it previously, not really the impact on women and men in different socioeconomic positions. So we would think of this economic person as one homogeneous group that is having the same needs, etc., etc. And once when we start applying gender perspective, we are really understanding that our decisions are impacting different groups of women and men very differently. And then it becomes also cause and consequence of gender inequalities. So it's very important, and you made actually a very good point. Program-based budgeting, performance budgeting, result-based budgeting, however we call it, in its core is measuring the result and impact. Where we go with gender budgeting, we are saying for who? Who is really having these results? And more often than not, unfortunately, we are seeing that these results are absolutely impacting different groups very differently. And I can give you many examples.
Yes, we are going to get to the examples very soon, because I think we want to hear from both failures and success here to actually get it very tangible. But I was just thinking about something that I didn't tell you before that I was going to ask you. So let's see. Because working on public financial reform, as I have done in Sweden and in Bosnia, it's sort of a very technocratic exercise, which is very, in my opinion, but this was some years ago, sort of very exclusive for an exclusive part of people that understand finances. So it's not really, even the parliament was not involved. Even the parliament doesn't have enough technical expertise to get involved. And civil society has a problem because it seemed to be a technical issue. And stakeholders were international stakeholders were mainly IMF and World Bank, because they are lending countries, so they want to see that financial management process in a good way, because they have a vested interest. So if you now talking about the gender-based budget in the way that you do, doesn't that also include having a lot of other actors involved?
Sure. I mean, that's a very good question. And it is something that I was also researching and experiencing a lot around. And it's actually really the truth that the budget and public finance management process was for many, many years super technocratic, super bureaucratic, super closed for these financial elites, very exclusive, saying that this is just a very technical exercise. And of course, the modern public finance management reforms, such as the one that you were also mentioning with program and performance budgeting, that is already opening up the budget process. So these movements towards opening up the budget process, making it more transparent, participatory, accountable, these are all happening for a while. Now, you rightfully said, this also means that you are including many different actors in the budgetary process. And I think I've seen in most of the countries that parliament, as you said, and in the end, budget is a political instrument. So in the end, the decision about budget is not technocratic, it's very, very political. So sometimes even if you prepare a perfect budget and perfect figures and perfect forecasts and base the whole budget on them, it might not end up looking the way the technocrats would like. So in the end, even the decision makers on budget don't have, as you said rightfully, don't have enough skill, don't have enough knowledge, and don't receive the budget early enough in order to analyze it. With gender budgeting, this all comes into play, of course. And what we are trying to do, we are trying to include all these actors as in the modern budgetary reform, but we are expanding the pool of actors and also including gender mechanisms, gender machinery. And in addition to that, we are also trying to educate financial people even more. And I'm very mindful when I say that, because this is not an easy undertaking in a sense, because sometimes people who are working with budgets don't see as their role to understand the impact to society, because we had these two, the socio and economic, very, very kind of two different paths. So what we are trying to do now, not only with gender budgeting, but with generally budget reforms recently, is to really put these two discussions together, because these are not two separate processes. And so to answer to your question, yes, we are trying to move one step further in the regular budget reforms processes, and it's not easy.
No, I think it's a challenge, and I think we have people in the audience that work in both audit office, Minister of Finance, civil society, that we hope to encourage to get involved. And for Minister of Finance people then to be a little bit more brave when it comes to getting out of their comfort zone. So in order to inspire, we need to hear some examples.
Sure. Well, before I get to the examples, just to say that I'm really glad that you have participants also from audit institution and the Ministry of Finance and civil society, because these are all the actors that should be engaged with gender budgeting. Now, having said that, before going to the examples, I would like to ask the participants to already maybe now stop and go and look, stop, and go and search for gender budgeting initiatives and work in your own countries. Because we have worked a lot on gender budgeting in all the Balkan countries and Eastern European countries and many countries around the world. So as we speak, there are more than 90 countries that are working very seriously with gender budgeting. And I always take up my task, if that can be said.
It's a mission.
To invite,
It's
a mission. But I really like to have to invite everybody to get involved, because it's a very rewarding process and it's very demystifying process of engaging with budgets and understanding the real implications of the decision making. So that's one. And as for the examples, I mean, I usually use very similar examples, because these made the biggest impact on me when I was learning about gender budgeting. But just to say that, for example, in Ukraine, we have analyzed, and when I say we, it's Ukrainian government, with the help of the project that I was working on, but also other counterparts, they have analyzed over 400 budget programs. And when we talk about budget programs, these are the programs in health, education, infrastructure, defense, so basically all sectors. And in each and every program, they have seen serious gender issues. And not only that they have seen serious gender issues, but there was not even one program in which you would say, okay, this is really working as we would want it to work. So when we work with gender budgeting, we are analyzing the programs, and this is something that is missing in many countries.
To analyze how its impact.
Exactly, to analyze the impact, to analyze whether the program is actually achieving what it was meant to achieve. And in this analysis, we are adding this gender dimension, meaning the sex desegregation of beneficiaries, and then also looking whether their strategic gender needs have been satisfied in a sense. But for example, okay, I will maybe give you the example of the health programs, because this was the area I was least experienced with, and I was invited to be part of the working group that was working on analyzing tuberculosis programs in Ukraine. And I remember that because I was part of that group, and it kind of stayed with me that when we started the process, we really didn't know what to expect and what can we find in this program, because it's a health program and it's a program that is directed to sick people, no matter of their gender, sex, etc. So we were thinking, okay, how do we go about there? But when we started analyzing, when you start gender analysis, the first thing is to see, of course, who the beneficiaries are. And when we just looked at that figure, first we saw that we don't have sex desegregated data at all. So we needed to, even though this data was collected, it was not presented in budget documents because it was deemed as not important. So then when we looked at this data, we've seen that almost 80% of the patients were men versus 20% were women. And this is, of course, big gap.
So strange.
It's strange and not, because globally tuberculosis is, we have more patients that are suffering from tuberculosis that are men, but not in this high percentage. And this is a gender matter, because why are they suffering more from tuberculosis is because they are engaged in the risk profession more, they go to doctors less. And in Ukrainian case, they were in the group that preventive measures were never targeted. So when we did preventive measures without gender perspective, so we are just trying to prevent people to get tuberculosis in the very simple terms, we would actually do preventive measures. I'm actually burning in the sun. Nevertheless, nothing can stop this important discussion, but I'm just melting. So when we did gender analysis, we have actually recognized that prevention measures are done in the sectors where women prevail. So it's health and education. and not in the areas where we would see patients coming from tuberculosis. Now, the other
like
thing
in
that
the
we did,
building industry or something.
mining.
Yes,
In Ukraine, it's a lot of mining
yeah.
and also rural areas.
Yeah.
So you would usually have preventive measures done mostly in urban areas, in a very, very clear professions, I'm saying education and health, where you need to do regular checkups. And then we've also, I mean, we are working with numbers and budgets. So we saw, okay, how much does it cost to cure the patient when the patient is in the first stage and when the patient is in the other stages, and also when it has these stages, it's called multi-resistant tuberculosis, which means that it's resistant to many medications. And we've also seen that in these groups, men prevail in really even bigger numbers. So it was very important to do
And that is because the men are not going to the doctors.
That's because they are not going to the doctors in the beginning. The preventive measures are gender blind.
Yes,
so they don't care if they don't understand. When I say they, it's these preventive measures. They don't really target the group that is in the biggest risk of getting tuberculosis. Just because it's gender blind, because it's assuming that there are no gender differences, and in health, of course, gender differences play a major role, and especially in Ukraine, where men have very low life expectancy, so they wouldn't even live until retirement. In fact, when you look at life expectancy,
so
it's gender.
So it's both a sort of medical, to be medically more prone to have it. Both maybe because of some genetics, but also because of the life you live. But it's also a behavioral thing, where men behave different to women and therefore are not targeted by the measure.
Exactly, but this is the heart of our gender norms, and this is what we are trying to. This is the discussion that we are trying to have, and we are trying to put that discussion when we are working with budgets. And maybe just to tell you what is now extremely relevant in this COVID crisis, is that we are looking at emergency measures. So all the countries are now trying to find the budget that didn't exist, or to reallocate existing budget to the emergency response. And this emergency response is usually either people focused or meaning health response, or we are talking about economic response, or we are talking about the social net and kind of social payments. So if we do that, and we are now doing it very abruptly, it's done overnight in a sense, it has to be because it's crisis. And if we do that without gender implications and understanding, we can actually really do a lot of harm. And so in many countries now that we are working with, and in many networks that I'm fortunate to be part of, which are colleagues working with gender budgeting, we are really trying to put this discussion in the budget discussion now, because now this is done really fast. So there is no time for a lot of advocacy and for a lot of research. You need to really
and if you then don't have the experience and the analysis done already on behavior and those things that you mentioned, then you might really do something very harmful.
You might do something very harmful. There is just one but. There is so many reports that are produced all over the world that are reporting on gender equality and the situation in different sectors. And if we just kind of not triangulate, but take this information in the budget discussion, we can already make much better decisions. So so I think UK Women Budget Watcher Group, for example, if you have time, you stop again and now go to UK Budget Watcher Group. This is a group of scientists and researchers who have for years been analyzing UK budgets from gender perspective. And we are actually having soon a presentation from UK Budget Watcher Group on what they have managed to do now in the COVID crisis for gender relevant response.
But then I have a question, and then I think we should break a bit to actually let Maja go into the shade. But is it really possible to draw conclusion from empirical data in the UK for instance, Georgia?
No, of course not.
No.
But in Georgia, you have reports in CEDAW, you have a gender gap report, you have many activist groups in Georgia. So, I mean, if we have participants from Georgia, genuinely invite them to connect or to look at what has been done from gender budgeting, in gender budgeting area, but also for gender equality. There is a lot of research and there is
to put these together.
And to put this together and to see how it relates to your job. Because I think in every sector we work with, in the end we are working for the sustainable development. We are working for people. So even if we don't see people in our papers and tables and budgets, they are there for the people. I mean, this sounds like a very fairy tale almost, but it's really the fact that we are sometimes putting these two discussions so far apart that we are not even aware that, I mean, the budgets are nothing but the vehicle to help the society develop. So
let's take a little break. So we are back, and we are going to hear a little bit more about this example from Ukraine and the tuberculosis budgeting or budget. So Maja, what happened in the end? Did you change anything, or did the government change anything?
Well, the government, what is very important, the government gave recommendations. So the working group that saw these inequalities within the program, and also very kind of illogical and really bad budgeting in a sense of not achieving the results. Because what they have done, they have first recommended that these sex desegregated data are not only collected but presented in the budget document. So this is very important, to have this data to be available and to be visible in the budget document. Then they have also gave a range of recommendations to the Ministry of Health on how to really how to solve this issue and how to do preventive measures for in the rural and remote areas, and for this risk group, in our case it was men. So now as we speak, this is in the process of changing. But we do have another example from health in HIV and AIDS. We saw exactly the same situation.
And one of the
HIV
okay.
and AIDS. Yeah. We saw exactly the same situation. And one of the oblasts that have done this.
And oblast is municipality.
I'm glad I have a sweater now. Sorry, it's really hot today.
This is
in
Swedish
Stockholm.
summer. It's tropical.
It's crazy. But so basically what we have done is that this region has, as a result of the analysis, they have purchased a mobile laboratory so that they can do the testing, and they can especially do the testing of the risk groups. And in this case, these were again men in the risk groups.
So they can go to a mine actually and do it.
They can go outside in the field, and they can go to rural areas and also do the testing of people who would not normally come to the test centers, and then would come with a full-blown AIDS, not HIV anymore. So that's there they already have results, and there they already have more cases discovered in early stages, etc., etc. And it's all a result of gender-based budgeting.
Yeah.
Sorry, no, something is eating.
Yeah, okay. It's really tropical. We have animals and we have heat. No, but so what you are saying here is, which leads me to another question. And now we have the police coming to. Maybe we will cut this.
and how the world is.
So this connects to another question, because the topic of today is, how can you use budget to have a more inclusive, let's say, government program or government interactions. And what you're saying here is actually, if you would say that vulnerable groups are poor people in the rural areas, gender budgeting has, as a consequence of analyzing impacts in relation to these budget activities or activities funded by the budget, you have also, as a bonus, helped marginalized groups.
Exactly. But I think it's also a very fair point that you said, and with gender-based budgeting, when we say gender, we really mean very intersectional and intersectoral. And when I say that we are taking a lot of different variables together when we are analyzing, this is the ideal circumstance of gender-based budgeting. So we are not only looking at men or women, we are looking into a much wider picture than that. And for example, I was also working with UNICEF on child-based budgeting. So you are actually really focusing on what happens with children. Are they part of the discussion? Are they part of the groups that are targeted? and more often than not, they're also not. So it's many different groups that we can see when we demystify the budget, and when we go into understanding what do we really want to achieve and who the beneficiaries are. And maybe just to say, because you mentioned IMF in the beginning, and I was also working a bit with the IMF and the World Bank. I'm really happy to say that in the past years, IMF has been really big proponent of gender-based budgeting. And they are starting to talk about gender budgeting as a good budget practice, which is very important, because in many of the countries from which you come from, and myself as well, IMF has a major role when discussing the fiscal policies and public finance management. And it's also an advisor when it comes to what the good budget process should look like. So if the IMF and our colleagues from the very financial arena, if they are not embracing gender budgeting as part of their job and their advice, then it is much more difficult. And then it remains the issue of activists and researchers, which are key to this, but cannot do it themselves alone. So I think that, and I will share with you a lot of links and materials, but maybe you can also stop now and look at the IMF site and look for gender responsive budgeting. And in 2016, IMF has done amazing research, global research. So there were colleagues around the world who were doing, who were analyzing what happened with gender budgeting in their regions. So we have gender-based budgeting in Asia, Africa, Europe, etc. And then we have a summary paper. So this is also quite important. And maybe the last point in this international discussion, and I think it's important because we are discussing budgets. So World Bank and other partners, World Bank, IMF, EU, and government of 6 countries, France, UK, and others, you can check. They established the PEFA Secretariat, and PEFA means Public Expenditure and Fiscal Accountability. So it is a system of measuring how well is public finance management system working in one country. So how well are institutions and processes established?
It's a lot of indicators that you
it's
will
76 if I'm not mistaken, and then we have sub-dimensions. But this is something that every donor does or is encouraged to do when they come to a country to provide assistance in budgeting and public finance management. So we have been advocating for a very long time that this kind of diagnostic tool includes gender perspective. Why? Because then it would mean that gender-based budgeting is part of the good budget practices. And I'm super happy to say that now this is done.
Now, like very recently.
In 6 months ago, well, maybe even less, 5. Now with Corona, I am a little bit confused with time.
We can say it was just pre-Corona.
Just pre-Corona, exactly. So it was in January when we had...
Now it's like the birth of Jesus Christ. Was it pre or post-Corona?
Yeah, exactly. Or in Bosnian case, before and after the war.
Yes,
so,
okay.
So this is the new now measurement. But yes, and we have the system to measure how well is one country working with gender-based budgeting. And we did it in Ukraine. So we did this assessment. We have done it, I have piloted it in Indonesia with the World Bank colleagues as well. Some other countries, Fiji did it as well, and Norway. So we are trying to work with Sweden as well to do the assessment, because, why is this assessment important? Because, and please go look, PEFA Gender Responsive PFM assessment. We will send you the links. But why is it important? Because it is telling you, budget officers, colleagues interested in working with budgets, where are entry points to include gender considerations in the budget cycle. And we have a lot more work to do in Ukraine. I am not happy to say, but also I'm happy with the work that has been done. But it's not an easy process, and there is more work to be done there as well.
So my last question is actually this one. Because so this program is about sustainability and co-governance and inclusion and innovative solutions to reach those goals. And often we get the questions, okay, it looks so very good in Sweden, you have this perfect system and everything, but where will we start? Where should I start? I come from, let's say Bosnia, Bosnia. Where should I start? Could these PFA indicators in the gender budget be one entry point?
Absolutely. I mean, that's also a very good question, because this is something for all of us working with development. This is always the first question. Okay, yes, it's easy for ABC country, but it cannot apply to my own country, and we hear that a lot. And I think, first of all, I think there is already a lot of work done, and I can bet with each one of you in all of your countries, but on gender budgeting as innovative tool. But this tool has been around for a while, and it can just be used more and for the better results. But I do think what you said, this assessment is a good way to start, because it provides an information to decision makers. Okay, this is what is considered good practice. This is what we have done. Even if we have done very little, we understand where else we can go. So I think this is a very, very, very good tool. In order for it to be done, the government needs to agree, and government needs to kind of ask for it. But I don't think that's a big challenge. Why not having the system assessed also and then improve?
And if the government don't agree, call the World Bank.
Yes,
Right?
they cannot influence it. Nevertheless,
Call the IMF.
call somebody. Call somebody. No, but all joke aside, it is an important thing. It's an important concept, and I think there is no way back, honestly, because I don't think there is a way back in not taking environment into account.
No.
I don't think we hit the wall. And I also think this crisis as well will also underline how important is this robust, transparent, accountable and inclusive financial processes, because when these kind of crises hit, it shows all the weaknesses of the system. And shall we had the system prepared better to start with, it would be less likely that we can do more harm now when the crisis hit.
Thank you so much, Maja. Thank you for listening.
It was a pleasure. I hope to meet you
On some forum,
On
in
some
real
forum.
life or in Zoom or whatever.
Yes.
We will be back.
Thank you very much. Thank you for inviting me.
Thank you.